going to open it up for questions, but as I do, I want to just take a couple of quick things that have been unbelievably distorted and misinterpreted out there. Number one, hear me carefully. If you leave this town hall with anything, I want you to leave here with this. No plan whatsoever, none of the plans in Washington are going to change your choice for what you have today. If you like what you have today, you can keep what you have today. And that will be in the final plan. We have not yet passed the plan out of the Senate. We passed one out of a committee in the Senate. Don't take one House bill or one committee's bill that may say something when the vast majority of congressmen and senators are opposed to it, which is why there's a lot of difficulty in getting us together on what we're going to come out with. I guarantee you that in the final passage of whatever it is we do, you will keep the insurance you have if you like the insurance that you have. And I promise you that will happen. Next, on the public plan, it always amazes me that some of the loudest voices against the public plan are sometimes the first to take advantage of public plans. Medicare is a public plan. Medicaid is a public plan. The Veterans Hospitals are a public plan. And I don't know any veteran in America who wants to give it up. Now, if you look at the proposal for the public plan as has been put forward in Washington, it does something quite extraordinary. It says, first of all, they must compete with the same rules as the private plans. Number two, there will be no public money massed in order to pay for them. They have to do pay-as-you-go through the enrollees and the premiums that they charge. And number three, there will be no bailout through public funds. And number four, no one will be forced to join into any public plan if they don't want to. It's pure choice option. But the reason that people argue for it is very simple. Look at the struggle people have today. Insurance companies can drop you right and left. People will tell you you're not covered. You have these unbelievable struggles, and some insurance agent with green eye shades is telling you and your doctor what your medical care ought to be. Yeah. That has to end. Doctors have to make the decisions, not insurance companies. Now, there are many, many things. We are probably in agreement in Washington. You don't know this, because the media has focused on the fight, and because there's been a major political strategy to try to deny our ability to move forward. But the fact is, we are in agreement on probably 85% to 90% of what we ought to be doing. We need delivery system reforms. We need insurance reforms. We need to be treating people not on the basis of how many times you go to the doctor and therefore get paid, but on how efficiently and effectively and collectively they treat you when you go to the doctor and what the outcome is. Those are the things we need to be doing. And everybody's in agreement by that. Two of the clinics that have been most celebrated in this process are the Cleveland Clinic and the Mayo Clinic. And you know why? Because they do what's called a global budget. They take a budget, their doctors are not getting paid on fee-for-service, they're on a salary. And they get paid according to the work they do and the quality of the care that they deliver. And they deliver extraordinary care to people. So, again, we're not trying to dictate which model anybody takes. This is America. We want the freedom of people to choose what they think is the best practice that they want. We want people to be able to say in one state, maybe something works better than in another state. Some rural states have challenges that urban centers don't have, and vice versa. And so we need to be flexible in how we do this. But the bottom line is, folks, if you set up any problem, as I just set it up, the things that are immutable, the intractable facts. Facts are stubborn things, as the saying says. And the fact is, there are some facts here we can't get away with. You can't get away from the fact that Medicare is going to be bankrupt in 2017. You can't get away from the fact that we spend 50% more than other countries and don't get the quality of care. These are facts. And if we're going to react to those facts, then we have to be smart and stand here and say, how do we do this in the most effective way that meets the values of our country? And the values are, people want to choose their doctor, people want to choose plans, people don't want the government messing in the middle of it, telling them what they can do and can't do. People want to have the right as individuals to choose the care they want, but they also want to know they can be covered, and if they can't afford it under any circumstances, we're going to help them be covered because that's more efficient for the entire system in the distribution of risk and in the efficiency that we create for everybody being able to have early detection, wellness, and prevention. That's another thing we have to do. The final thing I want to say. Final thing I'll say. You know, we are, I hate to say this, and it's not always an easy topic, but you know, those soda pop machines in schools, the diet of too many Americans breeds illness. We don't teach wellness early enough in life. We don't teach prevention enough in life. We don't have enough people to grab onto that. And we can save billions of dollars if we begin to put in place that. Now that's beginning to happen in America. Consumers, people are beginning to demand different kinds of foods. They're beginning to demand, you know, different opportunities for exercise, for wellness as part of their workplace. And many, many employers now are insisting that their employees, in fact, engage in these programs. I'll give you an example. I met with an employer in Washington the other day. He told me that they offered their employees $50 per pound that they lost. And they wound up with a collective something like 75,000 pounds that were lost in that company, and people took home additional funds, and people were healthier as a result of engaging in those kinds of behaviors. So there are hundreds of different things that we can do in order to deliver health care more effectively and efficiently and still keep faith with the American system of free enterprise and of choice and of our freedom to be able to choose where we get the kind of care we want and what kind of care we want. I think we can preserve the best and still wind up with a better health care system. And that's what we're going to try to do in the days ahead. On that note, let me throw it